Welcome back, guys. Now in this video, let's discuss about signaling pathways. How a hormone or a cytokine or some ligand is going to bring the changes within the cell by using secondary messenger system. Okay, so signaling pathways. Now, what you should know about the signaling pathways? See, there is a hormone. This hormone is going to act on the cell. It's going to act on the receptor, or it's going to act on the cell. So, within the cell, some effects are going to be seen. So, how this hormone is going to bring those effects? How it's going to do that job? That we will discuss now in this video. So, let's begin with the intracellular hormones. Okay? Intracellular hormones. So, what exactly are these intracellular hormones? See, these intracellular hormones, they can enter into the cell. Okay, they can cross the cell membrane. Why they are crossing the cell membrane? Because they are lipid soluble. Okay, they are lipid soluble, so they can cross the cell membrane and they can enter into the cell. So, what are the examples of these hormones? These hormones examples are the sex hormones. Okay, sex hormones like estrogen, testosterone, progesterone. Okay, progesterone. Next, hormones which are mineralocorticoids like aldosterone, cortisol, and thyroid hormones. Okay, thyroid hormones. See, all these hormones, they are lipid soluble, so they can cross the cell membrane. They enters into the cell. Okay, they enters into the cell. After entering into the cell, they are going to bind with the receptors, and that hormone receptor complex. Okay, the hormone receptor complex is going to cause the activation of the genes which are involved with that. Like they are going to cause the transcription, activation of the genes, the transcription followed by translation, and you are going to see the effects. So at the end of the day, the point which I want you to know is most of these intracellular hormones, they are steroids. Okay, all of them, they are steroids. Okay, see, they are steroids. Except the thyroid hormones. Thyroid hormones are not the steroids, but still they can cross the lipid membrane. Okay, they can cross the lipid membrane. Now, these intracellular hormones, where is the receptor present? The receptor is present within the cell. So, intracellular receptor. Okay, they are having intracellular receptor. The intracellular receptor may be intracytoplasmic receptor or intranuclear receptors. Okay, so these thyroid hormones, they have intranuclear receptor. That's the important question which was recently asked in the exam. They have intranuclear receptor. Okay, not only that, estrogens and progesterone also have intranuclear receptors. See, these are all steroids, right? Steroids means they are derived from the cholesterol, they are lipid soluble things. Okay, they are lipophilic things. So, in the plasma, they should be bound with some plasma protein. Okay, they are all the lipids. So, they should be bound with some plasma proteins. They can't simply travel in the plasma. So, they are bound with, in plasma, they are bound to plasma proteins. Which plasma proteins, sir? Estrogen or testosterone. They are bound with sex hormone binding globulins. Thyroid hormone bound with thyroid binding globulins, and cortisol, it bounds with cortisol binding globulin. Okay, cortisol binding globulin. And the same cortisol binding globulin is also going to bond with aldosterone and progesterone. Okay, progesterone. Next, let's discuss about the extracellular hormones now. See, these extracellular hormones, they cannot cross the cell membrane, right? They cannot cross the cell membrane. So, they have to act on a receptor, cell surface receptor. Their receptors are present on cell surface. So, cell surface receptor. Now, they use as secondary messengers. See, these intracellular hormones do not have any secondary messenger system. They directly enters into the cell. They bind with their receptors within the cell, and the hormone receptor complex is going to go and activate the transcription process, and they are going to mediate their effects. Okay, so intracellular hormones directly bring the effects by entering into the cell. But these extracellular hormones are going to act on a cell surface receptor. They use as secondary messengers. Okay, secondary messengers. Okay, secondary messenger system for their function. Okay, secondary messenger like systems for their action, or sometimes they can use as the cell surface receptors. Okay, directly they can use the cell surface receptor. This receptor itself, the cell surface receptor itself is going to bring the effects. Okay, receptors can directly show the effects, or by producing the secondary messengers, they can exert the effects. Now, what are the two types of cell surface receptors which are involved in bringing out these effects? So, which cell surface receptors will bring out these effects are, let me write here, surface receptors bringing the effects in the cell. Which cell surface receptors? Tyrosine kinase receptors. Okay, tyrosine kinase receptors. And there is one more pathway which is called as JAK-STAT pathway. Okay, JAK-STAT pathway. Okay, and which secondary messengers are going to bring these effects in the cell? The secondary messengers include CAMP, CGMP, and IP3. Okay, inositol triphosphates. These are the secondary messengers which will bring the effects in the cell. Okay, now let's begin with the receptor tyrosine kinase. Receptor tyrosine kinase. Okay, receptor tyrosine kinase. It's very simple to understand. See, this is a cell. On the cell surface, there is a receptor. See, this is the tyrosine kinase receptor. When a ligand is going to come and bind here, okay, when a ligand is going to come and bind here, see, there are tyrosine residues, right? See, these tyrosine residues are going to be there, okay, in the receptor. Now, this tyrosine residues are going to be phosphorylated. When a ligand is going to come and bind from outside, see, from outside, some ligand is going to come and bind, or some hormone is going to come and bind. So, that causes the phosphorylation of the tyrosine residues. Okay, phosphorylation, the name itself is there. So, tyrosine is getting phosphorylated. Okay. So, once the tyrosine phosphorylation occur, it is going to directly, so it's going to just move away from that area. This phosphorylated tyrosine, it's going to move away from that area, and it is going to activate, and it's going to bring the changes in the cell. It's going to go and activate the transcription process, and it's going to bring the effects in the cell. So, no one is going to ask you about that. But what they will ask you is, which hormones, what are these hormones which are going to use this tyrosine kinase receptors? The two important hormones are insulin. Okay, so insulin is going to use tyrosine kinase receptors. Apart from that, the growth factors. So, which growth factors? Any growth factor like insulin, like growth factor. Okay, insulin like growth factor 1, which is also called as somatomedian C. Next, fibroblast growth factor, epidermal growth factor, platelet derived growth factor. All these growth factors are going to use tyrosine kinase receptors for their action in the cell. The second pathway is called as JAK-STAT pathway. Okay, JAK stands for Janus kinases. Janus kinases. And STAT. STAT stands for Signal Activator of Transcription. Okay, so signal transducer and activation of transcription. STAT stands for Signal Transducer and Activation of Transcription. So what happens here is also very simple. See, here there is a cell. On the cell, there is a receptor. Here is a receptor. Okay, now once the hormone comes and binds here, okay, first intracellularly JAK is going to be activated. Okay, Janus kinases are going to be activated. Now these Janus kinases are going to cause the phosphorylation of STAT. Okay, there is one more protein which is called as a STAT. This Janus kinases, see, they are kinases. They are going to cause the phosphorylation of the STAT. Now this STAT is going to go and help in the transcription. And the transcription is going to help in the production of proteins, transcription, translation, protein production. That's going to bring the effects in the cell, effects. This is a pathway. Okay. Now, which hormones uses this JAK-STAT pathway? Okay, this JAK-STAT pathway is used by which hormones? See, many cytokines like interferon, gamma, interleukin 2, interleukin 6, these are the cytokines which are produced by the macrophages, right? So these macrophage cytokinins like interleukin 2, interleukin 6 and interferon gamma, they are going to use the JAK-STAT pathway. Not only that, those hormones which are going to act on the bone marrow, okay, which are going to act on the bone marrow and hematopoiesis like erythropoietin, colony stimulating factors like GCSF, granulocyte colony stimulating factor, and thrombopoietin. Okay, so erythropoietin for RBCs, thrombopoietin for platelets, and granulocyte colony stimulating factor for the production of granulocytes like neutrophils, you know it, okay, neutrophils, basophils and eosinophils. And other hormones like prolactin and growth hormone. Okay, they also uses this JAK-STAT pathway for their effects on the cell. So with this, what we have completed is the receptors which are involved in direct effects. So receptors are going to cause the phosphorylation of the proteins, and the phosphorylation of the proteins is going to bring the transcription, and effects are going to be seen. Next, let's discuss about the secondary messenger system. Secondary messenger. You know the secondary messengers. The first secondary messenger that I am going to discuss here is called as the cyclic AMP or cyclic AMP. What exactly is going to happen, sir? See, now again here cell is there. Okay, cell is there. Now, on the cell surface, there is a receptor. So what is this receptor, sir? This is G protein coupled receptor. It's a GPCR, G protein coupled receptor. Okay, which are the serpentine receptors. Okay, this is a GPCR. Now, some hormones, what are the hormones I will explain later. Some hormones are going to come and bind with this G protein coupled receptor. Okay. Now, when the hormone is coming and binding with the G protein coupled receptor, intracellularly this receptor is attached with a G protein. Okay, it's attached with a G protein. This G protein is having three subunits: alpha subunit, beta subunit, gamma subunit. Alpha, beta, gamma subunit. Three subunits are going to be there. And usually, when the cell is not activated, when it is in inactive state, the alpha subunit is bound with GDP. GDP is bound. Okay, alpha subunit is bound with the GDP. Now, when hormone is coming and binding here, that GDP is going to be replaced with the GTP. Okay, it's going to be replaced with the GTP. Now, this GTP bound, once the hormone comes and binds with this G protein coupled receptor, this alpha subunit, okay, this alpha subunit is going to move away. The alpha subunit is going to move away. Now, this alpha subunit is going to activate, which is activate something called as adenylyl cyclase. Okay, so an enzyme is being activated. So what this enzyme is going to do, adenylyl cyclase. So this adenylyl cyclase, okay, this adenylyl cyclase is going to convert ATP which is present in the cell to CAMP, cyclic AMP. So this is how the cyclic AMP levels are going to get increased in the cell. So it's simple. G protein coupled receptor is activated. The alpha subunit, okay, is going to break the is going to remove the GDP, and in that place GDP is going to come and bind. So once it binds, the alpha subunit is going to move away from that area. So alpha subunit will go and activate adenylyl cyclase. The adenylyl cyclase, this enzyme is going to convert the ATP into cyclic AMP. Now what the cyclic AMP is going to do? It is going to activate something called as protein kinase A. Protein kinase A is going to be activated. Now, say it's a protein which is a kinase, protein kinase A. This protein kinase A is going to do the phosphorylation of many proteins within the cell. So, that is going to bring the cellular changes. So, this protein kinase A is going to bring the effects by doing phosphorylation of different channels, different enzymes, different proteins within the cell. Okay. So, this is how cyclic AMP is going to exert its effects. Now, question is, which hormones uses this cyclic AMP system? Hormones like, let me write from hypothalamus, from the top. Which hypothalamic hormones? Hypothalamus. So, hypothalamic hormones like CRH, corticotropic releasing hormone, and growth hormone releasing hormone, GHRH, not GnRH, GHRH, growth hormone releasing hormone. Okay, two hypothalamic hormones which uses the secondary messenger system, cyclic AMP secondary messenger system. Next, which anterior pituitary hormones? Which anterior pituitary hormones uses this? FSH, LH, TSH, okay, and one more thing which is called as the beta HCG. Okay, so FSH, LH, TSH, and ACTH, okay, ACTH, and it's not an anterior pituitary hormone, but one more thing which is called as a beta HCG. Okay, sorry, not beta HCG here. Beta HCG is not an anterior pituitary hormone, but beta HCG also uses a cyclic AMP. Why I am trying to put beta HCG here is because beta HCG, the alpha subunit of the beta HCG and FSH, LH is going to be similar. Okay, alpha subunit of FSH, LH, TSH and beta HCG, they are like similar hormones. So that's why I am just including it here. Okay, but it's not an anterior pituitary hormone. Next, what other hormones uses the cyclic AMP? Is parathyroid hormone? Okay, parathyroid hormone and other hormones. Now I am going to discuss about the other hormones like glucagon. Don't forget, insulin is using tyrosine kinase receptors for their action. Glucagon is using cyclic AMP. Antidiuretic hormone, when it acts on the V2 receptors, important, antidiuretic hormone have two receptors, V1 and V2. When antidiuretic hormone is acting on the V2 receptors on the collecting ducts, it increases the intracellular cyclic AMP levels, cyclic AMP levels. Okay, next, histamine receptor. Histamine, when it acts on the H2 receptor, histamine acts on the H2 receptor to increase the acid in the stomach. It also uses cyclic AMP levels to bring this effect. So, one more important hormone I have explained you, the other hormone, that is the beta HCG, and melanocyte stimulating hormone, MMH. Melanocyte stimulating hormone also uses the cyclic AMP to show its effects. So, which hormones, in your exam what they will ask you is solely this, which hormones uses the cyclic AMP system, which hormones uses the cyclic GMP system. Now, let us discuss about the cyclic GMP. Okay. Second messenger is cyclic GMP. Now, how to understand this? What happens in cyclic GMP system is, again there is a cell here, okay, again there is a cell. Now, here is a receptor, okay, here is a receptor. Now, when a hormone comes and binds with its receptor, okay, when a hormone comes and binds with this receptor, this is also G protein coupled receptor, okay. Now, a different protein is going to be activated, okay, different protein is going to be activated. What is that? See, intracellularly here also alpha subunit is there, but this alpha subunit is of a different type. Here the alpha subunit is a G stimulatory type of alpha subunit, G stimulatory type. Here the alpha subunit is GQ type, okay, GQ type. Now what happens is, when a ligand comes and binds here GTP is binding, okay, previously GDP is binding, now it is going to be GTP. Now what happens when some hormone comes and binds here? Now this alpha subunit is going to move away, it is going to go and activate something called as guanylyl cyclase, not adenylyl cyclase now guanylyl cyclase. Okay, guanylyl cyclase or guanylate cyclase. Okay, guanylate cyclase is going to be activated. Now, what this guanylate cyclase is going to do? It is going to take the GTP and it's going to be converted into, okay, CGMP. So, cyclic GMP. So, this is how cyclic GMP levels are going to get increased in the cell. So, hormone is coming and binding here. That hormone is going to activate the guanylyl cyclase. The guanylyl cyclase is going to convert the GTP into CGMP. So, which hormones uses this CGMP as a secondary messenger to bring the changes within the cell? The hormones are, most of the hormones are going to do the vasodilation, like nitric oxide, okay, nitric oxide. Next, BNP, ANP, atrial natriuretic peptide, brain natriuretic peptide, and nitric oxide. Most of these hormones are the vasodilators. Okay, so vasodilators are going to use which secondary messenger system? CGMP as a secondary messenger. What are the hormones? Nitric oxide, atrial natriuretic peptide, and brain natriuretic peptide, which is produced from ventricles. Atrial natriuretic peptide is going to be produced from the atria, and brain natriuretic peptide is produced from ventricles. Done. Next, the third messenger is IP3. IP3 stands for inositol triphosphate. Okay, inositol triphosphate, which is simply called as IP3. Okay, IP3. So, what is happening here is, so there is something called as phosphatidyl inositol bisphosphate. Okay, phosphatidyl inositol bisphosphate, which is present in the cell. This phosphatidyl inositol bisphosphate is going to be converted to IP3, inositol triphosphate, with the help of an enzyme called as phospholipase C. Phospholipase C. Okay. So, how this is going to occur, sir? Look, say again cell is there. On the cell surface, there is a receptor. Now, when some hormone comes and binds to its receptor, okay, when some hormone comes and binds to its receptor, now, what happens is, once this receptor is activated, this receptor is going to activate the phospholipase C within the cell membrane. It's present in the cell membrane. So, this phospholipase C is going to break the phospholipids. Okay, in the name itself it's there, phospholipase. It's going to break the membrane phospholipids into two components. The phospholipids are going to break down, okay, PIP, phosphatidyl inositol bisphosphate. The PIP is going to break down into two substances which are called as diacylglycerol DAG and IP3 inositol triphosphate. So, this is how the inositol triphosphate is going to be produced within the cell. This inositol triphosphate, at the end of the day, it increases the intracellular calcium levels, and this intracellular calcium is going to bring the changes within the cell. So, which hormones uses this IP3 DAG system? This IP3 is a secondary messenger, not the DAG. Okay. So, which hormones uses this? Again, this is also G protein coupled receptor. Okay. Now, hypothalamic hormones like GnRH, gonadotropin releasing hormone, thyroid releasing hormone, okay, thyroid releasing hormone, gonadotropin releasing hormone. These are the hypothalamic hormones. Next, posterior pituitary hormones like oxytocin and vasopressin, antidiuretic hormone, when it acts on the V1 receptor. Okay, antidiuretic hormone acting on the V1 receptor is going to increase the intracellular IP3 levels. Next, other hormones like histamine, okay, histamine when it acts on the H1 receptor, angiotensin 2, okay, angiotensin 2 and gastrin. See, these hormones, gastrin, angiotensin 2, histamine, okay, oxytocin, antidiuretic hormone, GnRH, TRH, all these hormones are going to increase the intracellular IP3 levels to bring the changes within the cell. So, here what I have explained to you is, if a hormone is intracellular hormone, it doesn't require any secondary messengers. So, intracellular hormones are steroids. They are having intracellular receptors, they bring the changes directly. Extracellular hormones, either they use as receptor for direct effects in the cell to mediate direct effects in the cell, or they use as secondary messengers like CAMP, CGMP or IP3 to bring out some changes within the cell. Okay. So, with this, we have completed the topic of intracellular signaling. Hope the video is helpful. Thank you.